Hello everyone, welcome to our channel. Today we are going to discuss about the physiology. In the first part, we are going to discuss the cellular physiology, nerve physiology, and the neurophysiology. All important PYTs from all the INSCT, NEETPG, and the UPSC CMS and FMG we are going to discuss. So basically, in this, I am going to brief up the important PYTs, high topics, and expected topics, which is very important for our revision. So please stay tuned for the part 2 and part 3 also, and also watch the previous videos on the other subjects. So those who are new to this channel, please do subscribe and share with your friends. So let's start the discussion. First, we are going to discuss about the cellular physiology. In the cellular physiology, that you have to remember the feedback mechanism. There are the three types of the feedback mechanism: positive, negative, and the feed forward. What are these? So positive feedback means push forward. Okay. So for example, some function is going to happen. You are going to increase that function to finish that the process. Okay. For example, action potential and LS search, clotting, parturition. Okay, all these what we are going to do, we are going to push to increase that function. Whereas negative feedback mechanism is pull backward. If it's already going to increase, we are going to decrease it. Okay, for example, TSH produced a T3. Okay, it got the normal. Once it got the normal, it will tell the TSH, please stop. Okay, that you have to stop. So this is the negative feedback mechanism commonly seen in the hormones and the baroreceptors for the brain, for the BP, carotid, and also carotid sinuses you are going to see. And feed forward mechanism is no stimulus, but it is an anticipatory. It's not something the stimulus to increase or to decrease. It is just an anticipatory. How does it work? For example, if you're thinking about the exercise, your heart rate will increase, your BP will increase, and while you are the surrounding area is cool, your body try to compensate with the heat. And when you are talking about the food, you are inside your brain, there is a smell brain that will going to cause the salivation. Okay, all these are going to be the feed forward mechanism. Next, coming to the cell organelles, you all know that eukaryote consists of the all these important cells. Okay, nucleus, nucleolus, mitochondrion, lysosomes, Golgi body, centrioles, microtubules, smooth endoplasmic, rough endoplasmic, and the ribosomes. But we have to know about the important function of those. So cell membrane contains of the protein, lipids, and also carbohydrates. But the majority is the protein in the inner mitochondrial membrane and the lipids which will consist of the phosphatidylcholine or the lecithin. And why this cholesterol is important for the membrane? Because it will maintain the fluidity and it is easy to pass the particles, receptors and hormones. All the communication will be easy to pass this membrane because of this fluidity. Rough endoplasmic reticulum which will contains of the ribosomes, and that is important for the protein synthesis, protein eradication, and with the help of the chaperones, protein folding. Next, smooth endoplasmic reticulum for the steroid synthesis, drug detoxification, calcium storage. Golgi apparatus is like an Amazon office. How? For example, there are the two entries. One is the cis entry, another one is the trans. Cis is the entry for the RNA or the DNA. So they will do the modification, post-transitional modification, post-transcriptional modification, which will happen in the Golgi apparatus. And once they are transformed, from the other end, from the trans end, they are going to be transported into the vesicles. Lysosomes, they are like a suicide bags. They are causing the acid mediated destruction, whichever it is not important in our body. Peroxisomes, oxidation of the long chain fatty acid, very long chain fatty acids, and it also produces the oxygen radicals. And nucleus is important for the DNA chromosome structures, and mitochondria for the ATP synthesis. Microtubules, such as here you can see, this is the cell body. The dynein protein is important for the retrograde. Here you can see from the terminals to the body, that is the retrograde axonal transport. Kinesin is the opposite, it is going to be the anterograde. Okay, and the tubulin is for the mitosis movement. So if you want to stop the tubulin, you are going to make the anti-tubulin drugs, such as whichever we are using in the anti-chemotherapy. They all are going to inhibit the tubulin action, so there won't be the mitosis. So this is how anti-tumor drugs will be working, such as vincristine, all these drugs. Next, microfilaments, myosin and the actin for the muscle proteins, and intermediate filaments such as the keratin for the skin, desmin for the muscle, vimentin for the connective tissue. So these intermediate filaments are most abundant in our cells, so we are going to use for the tumor markers. Next, cellular junctions. So cellular junctions, here you can see from this image, cellular junctions will be present in our all the systems of our body. Okay, different systems we are going to have. Tight junctions, where it is going to be the very interlocking system. And next, anchoring junctions, these are the adhesions which are going to be the protein filaments, and desmosomes for the skin, which will be the linker between the intermediate filaments and the skin surrounding structures. The gap junctions is between the cells. Okay, let's see one by one example. The tight junctions, which will be contents of the protein, zonula, occludins and the claudins. It is present in the blood-brain barrier, blood-testis barrier, GIT and the kidney. Next, gap junctions, which will be contents of the connoxon protein and present in the GIT, heart, myocardium, and in the heart it is going to form the syncytia. Okay, electrical conduction will be passed here. Desmosomes, desmoglein, intermediate superficial filaments in the dermis, such as the skin and the cervix. Wherever the mechanical stress, it is going to work. Hemidesmosomes linked to the basolateral area. For example, here hemidesmosomes, this will be present here in the basolateral membrane. Jonula adherens, which will be contents of the cadherin protein, and it is a calcium dependent linkages. Next, receptors and the mechanism. If this is a cell, there is a receptor here, there is a receptor here. How they are going to act? If it is an inside cell, that is a cytoplasm receptor. The examples are the cholesterol, steroids, androgens, and the vitamin D. If this is a cell and in the nucleus we have, there is a receptor here. Those are the nuclear receptors: thyroid, estrogen, progesterone, and the vitamin A particles that is going to be work here. Next, second messengers is very important for the second messengers to act. Once the G protein coupled receptors is acted, they are going to act on the second messenger only. Okay, they are going to act on the second messenger. How? For example, CAMP, this is important for the glucagon and the secretin, vasopressin V2 and the epinephrine. Why these are going to act? For example, glucagon, this is going to increase the glucose production. Secretin for the acid production, and vasopressin V2, this is for the ADH production. Epinephrine is for the activity, ionotropy activity for the body. Next, IP3 DAG, that is for the vasopressin 1. This is the vasoconstriction, endothelin vasoconstriction, oxytocin, smooth muscle relaxation, and the TRH for the thyroid synthesis. Next, CGMP for the natriuretic peptides and also nitric oxide. Next, membrane transport process. This is very important. Membrane transport process, we have the two types. One is the active transport, other one is the passive transport. Active transport needs the ATP. Why? Because it has to cross through the against the concentration gradient. If we say this is like a uphill, you are going to the uphill, you need the energy. And passive transport, you are actually climbing downwards, you don't need much energy as much as you have climbed above. No ATP needed, it is proportional to the concentration gradient and the downhill transport. But examples are very important here. In the active, we have the two types, primary active and the secondary active. Primary active for the sodium potassium ATPase pump. Here you can see this is the sodium ATPase pump. There are the three sodium going out and the two potassium coming in. Okay, so this is the sodium potassium ATPase pump. Next, secondary active for the sodium iodide and SgLT2, chloride bicarbonate and the calcium. Next, coming to the passive, simple diffusion for the oxygen and the carbon dioxide, facilitated for the glut and the aquaporins. Next, fluids and the electrolytes, we have to understand for the total body mass average, there are the 60% of the fluids, and in the 60%, two thirds will be intracellular inside the cell, and the one third will be the extracellular. Okay, for example, these are the cells, this between, this is going to be the extracellular fluid, and in the one third also there will be 80% interstitial and 20% you are going to have in the capillary. And if we want to measure this for the total body water, we will be using the tritium and the deuterium, and for the ECF we are going to use the inulin, and ICF we are not cannot go into the cell and calculate. So for that, what we are going to do, first we measure the total body water, and the ECF we are going to minus, and that will be the ICF. And plasma volume, Evans blue and the albumin. Next, coming to the hypertonic, isotonic, and the hypotonic. So, what does this mean by? So, basically, our osmolarity will be 295 on average, which will be the common for the all the human beings, and we are need to compensate with the fluid. Okay, isotonic means equal solute concentration. So, whichever the fluid you are taking from the glucose and from your body within your body, they both are same. So, there is no not going to be the much change. And the hypotonic, the solutes will be inside our body only the more, but the whatever the fluid that we are taking, it is very less. So what happens hypotonic, so these all are going to be shifted, the water is very permeable in the osmosis, they are going into the shift into the cell, which will cause the cell swelling. And hypertonic, the solutes are in the outside only more. What happens, this is whatever the inner cellular fluid will be coming out into the blood vessel, right? So this will cause the shrinking of the cell. Okay, next, Darrow-Yannet diagram. This is very important for our understanding. So Darrow-Yannet diagram, this is the normal, this is the normal, this is the normal, and outside whichever the dots line, that is the abnormal. Okay, for example, if you give the isotonic solution, what happens, basically it is equal only, but slight increase in the extracellular fluid will be seen. The osmolarity is same and the ICF same, but the ECF will be slightly increased. Next, this is the hypotonic. Okay, as I say hypotonic, the intracellular fluid will be swelling, so intracellular cell will be increased, same as the extracellular fluid that will be decreased, and osmolarity is also going to decrease. And hypotonic, or we all know that that is a high osmolarity, and ECF will increase and ICF will be decreasing its size. Okay, this is how you have to identify the Darrow-Yannet diagram. Next, coming to the nerve action potential. Nerve action potential, there are the phases here. This question has been asked in the last 2 years, has been asking compulsory, so we have to understand. First, this is the resting membrane potential. What is the resting membrane potential? It is the electrical differences across the cell when the cell is in the resting position. Right? Here the resting membrane potential. When there is a stimulus, it is going to cause a depolarization. Okay, and after that there will be something out, and that something out will be causing the depolarization, and here again back to the resting membrane position. Sorry guys. Which will cause the resting membrane potential. So let's see one by one. The phase 1, there will be slow sodium influx, which is a going to be the stimulus. And phase 2, this is the depolarization, a rapid sodium influx. Phase 3 is the potassium efflux, which will be causing the repolarization, okay, negative. And the fourth phase, there will be slow influx, that is causing the hyperpolarization, slow sodium efflux, and the chloride influx, which will be causing the hyperpolarization. So what is the absolute refractive period, relative refractive period? So these all phase until here, this is the absolute refractive period. So even if you give the multiple stimulus also, there is not going to be the any another stimulus, but in the relative refractive period here in between, so even if you give the second stimulus, again it is going to cause the action potential. That is the difference between the absolute refractive period and the relative refractive period. So whenever you see, if there is a increased, the basically in the cell there is a negative, and outside will be the positive environment, right? So for example, let's say when there is an increased potassium in our blood, what happens? So the diffusion will be stopped, so the cell will be in the state of the positive only, so that will cause the more excitability. So if in our body the potassium is low, the diffusion will be more, the cell will be more negative phase, there is no excitability. So the resting membrane potential of the neuron is the minus 70 millivolts, and skeletal muscle is the minus 90, cardiac muscle is also minus 90, and equilibrium potential of the potassium minus 90, sodium is plus 60, chloride minus 70, and calcium plus 130. Next, coming to the muscle contraction. Muscle contraction, you have to understand the what is sarcomere. Sarcomere is an basic functional and structural unit of our muscle. So it has the two Z lines. So this is the Z line. Okay, in between the Z line you have the these filaments. What are these filaments, guys? These filaments are the I bands, which is the actin, and in between there will be the myosin filaments. Okay, A band. So this is the connecting, that will be the titin, and this is the midline, and this is the H zone. What is the H zone? There is a non-overlapping of the actins, non-overlapping of the actins in the myosin chain. Okay, this is the structure of the muscle sarcomere. So when there is a muscle contraction, what happens? The Z lines is going to come together and M line is going to disappear. Okay, they are going to form like this, and this is between the myosin, and A band is unchanged, but the I band becomes the shortened, right? The I band length is shortening, M line is disappeared, Z lines is coming together. This is the muscle contraction that is going to happen, right? Let's see how the muscle concentration is going to start. First there will be sodium influx, okay, into the neuron junction presynaptic. There will be sodium influx and potassium efflux, which will going to cause the resting membrane potential of the minus 40. Okay, beginning of the action potential. So this will be sensed by the voltage gated calcium channels, which opens the calcium, and once the calcium is opened, the calcium is going to influx, and it will make the exocytosis like vesicles. Okay, these vesicles will be filled with the acetylcholine, and the acetylcholine is going to released, and once they are released, they are going to act on the nicotine acetylcholine receptors. Once the nicotine acetylcholine receptor is activated, that will cause the sodium influx in the postsynaptic vesicle. The ligand gated sodium channels open, right? This create the end plate potential in the synaptic vesicle in the postsynaptic of the muscle, and that will trigger the action potential, and the calcium release will be seen. Where this calcium release will be seen, the action potential is going to act on the T tubule of the muscle. T tubule of the muscle, which will be consisting of the dihydropyridine, which will activate the mechanical activation of the ryanodine receptors, and this ryanodine receptor will release the calcium. Once this calcium is released, it is going to activate the actin troponin calcium binding, and there will be the myosin will be activating here. So in the step 1, step by step, what happens? So there will be the ATP production. Okay, the ATP production, which will connect the ATP to the myosin, and this myosin head splits ATP and causes the hydroxylation, and this hydroxylation converts the ADP and the phosphate. Once the myosin head binds to the actin, forming the cross bridge. Here you can see, once this calcium is activated, that is connected here. Okay, the myosin and the actin is going to form the cross bridge formation, and once the cross bridge formation is happened here, so the myosin head is going to rotate towards the center and sarcomere power stroke. Once this power stroke is completed, the myosin heads binds to the new ATP, and again the detached from the actin. So this is how the cycle will be going to form the contraction of the muscle. So here you can see, this is the nerve impulse. The calcium channels are open, exocytosis which will release, and here the binding of the nicotine receptors, action potential is formed. So this is the neuromuscular junction formation. Next, some of the important graphs that you have to see: sarcomere force and the length. Force is nothing but the tension, so which is having the maximum tension. So here you can see, this is the point A, this will be having the less tension, and B to C, here the stable tension, guys. The maximum tension will be seen here only, because here you can see the overlapping is also clear here, right? Next, D, there is complete no tension in the D, Here you can see that D does not have the tension. A will be having the maximum tension. B and C, sorry, A will be the less tension. B and C will be the maximum tension in the muscle contraction. And another graph, this is the 2026, the January examination PYQ. So we are actually checking between the strength and the duration. Okay, strength and the duration. So when you give the normal stimulus to the nerve, so what happens, there will be stimulus. Okay, Rio base is nothing but the very minimal stimulus that you give. So this is the minimal stimulus, the Rio base, and this here you are seeing. So this is the time. Okay, this is the time. So maximum is only going to give the this utilization time is known as a time T max of the Rio base. And if you increase this stimulus, for example, this is the minimal, make it the maximum. Okay, this is the 2 times of the Rio base, and whatever the time that you are getting here, that is the Chronax C. Okay, so now tell me, what is the Rio base? Rio base is nothing but the minimal stimulus, 2 times the Rio base maximal stimulus, and Chronax C is the utilization time of the nerve. Next, coming to the muscle fibers, there are the 3 types of the muscle fibers: type 1, type 2A, type 3B. Type 1A is the slow, type 2A is the fast, and type 2B is also fast. 1 is going to be the red in color, and 2A is also red in color, 2B is also white in color. Why red in color? Because of the contents of the myoglobin and the oxygen, and 2A is also red because of the myoglobin and the oxygen. White it is because of the there is no myoglobin, there is no oxygen. So it is in anaerobic cycle and glycolytic pathway. So 1A and 2A is going to be activated by the oxygen, aerobic and oxidative. But the 2A also have the other properties like glycolytic pathway. And what are the example? Sitting, standing and running, where you are going to see the maximum fatigue. So here you are going to see the maximum fatigue. Continuing with the discussion of the neurophysiology, right? In the neurophysiology, you have to understand there will be the macroglial cells. What are these macroglial cells? Cells, guys, astrocytes, nourishment for the neurons, blood-brain barrier, and synapse clearance of the electrolytes. Satellite cells is an supportive cells. Oligodendrocytes is for the myelin sheath in the CNS, and squam cells is the myelin sheath in the peripheral nervous system. Ependymal cells is for the CSF production. And the neurotransmitters, we have the serotonin, which will be presenting the raphe nucleus. This is for the awakefulness, peristalsis, and the platelet aggregation. Norepinephrine is present in the locus coeruleus. Awakefulness is the property. Acetylcholine is present in the nucleus of the minute, and it is also present in the neuromuscular junction for the memory, REM sleep, and also muscle contraction. And histamine is present in the posterior hypothalamus for the arousal of our body. Next, inhibitory, the most common is the GABA, excitatory is the glutamate, but both inhibitory and the excitatory, that is the glycine. Next, there is a classification for the myelination, the Erlanger-Gasser classification. So they consist of the A, B and C. So A is subdivided into the alpha, beta, gamma, delta. Alpha is for the muscle and the Golgi tendon, beta is for the touch and pressure, gamma is for the motor and the spindle, delta is for the fast pain. B is for the preganglionic motor, C is for the slow pain and the postganglionic. Okay, so the diameter is going to decrease from the A to C. So the smallest will be the C, the biggest will be the A. And same as the nerve conduction, the no diameter means no nerve conduction. That means myelin sheath will be decreased here. So the C will be the least nerve conduction, A will be the most nerve conduction. Another classification by the Lunt, 1A is for the muscle spindle, 1B is for the Golgi tendon, 2 is for the touch and pressure, 3 is for the fast pain, and 4 is for the slow pain. Next, skin receptors, we have the Meissner's corpuscle, Merkel's cells. Meissner's is the superficial cell for the touch, stroking, lips and the fingertips touching. Merkel's is for the deep, which is very slow, and it is present in the corners. Okay, whenever you see corners, edges, the feel that you are feeling and the Braille art, that is coming from the Merkel's. Pacinian corpuscles is the superficial corpuscle, rapid high pressure and the vibration you are going to feel. And Ruffini endings, it is present in the deep and slow, and the skin stretch will be coming from here. So the fast pain and the slow pain, what is the differences? So fast pain is the A delta and slow pain is the C fibers. And the fast pain is present in the neospinothalamic pathway and slow pain is in the paleospinothalamic pathway. This pain is sharp because of the myelin sheath, nerve conduction is very fast, and here it is dull because of the nerve conduction is and the myelin sheath is not present, and the nerve conduction is also slow. Endogenous opioids such as the acupuncture, endogenous cannabinoids such as the stress induced. Next, ascending tracts. So in the ascending tracts, you are going to see the two types of the tracts, guys. One is the spinothalamic tract, other one is the dorsal column tract. Okay, so the spinothalamic tract, here you can see where is the decussation is present. So decussation is nothing but the crossing over. Here you can see in the spinothalamic pathway, the decussation is present in the spinal cord itself, right? So it is going to laterally for the pain and the temperature, anteriorly crude touch and the pressure. Okay, so this is the spinothalamic pathway and the decussation is present in the spinal cord only. And next, dorsal column pathway, the decussation is in the medulla. Okay, the decussation is in the medulla and it is going to cause the proprioception, fine touch, stereognosis. These are the functions of the dorsal column tract. Next, descending tracts. These are the motor tracts such as the corticospinal tract, which is for the voluntary movements. Okay, and the name itself telling corticospinal tract. So this is coming from here only. Again, this is also again in the medulla region only. It is going to decussation is going to take place. And extrapyramidal cells, you have the four different types. One is the rubrospinal pathway, that is for the flexures and laterally it is present, and vestibulospinal, this is for the balance, reticulospinal is for the muscle tone, and the tectospinal is for the reflex of the head and neck. Okay, next, upper motor neuron versus the lower motor neuron. Upper motor neuron is going to increase the tone, increase the reflexes, whereas lower motor neuron decrease the tone and the reflexes if there is a lesion. So if there is an increased tone, there won't be the atrophy, right? Always continuously movement means there won't be the atrophy, but the decreased tone can cause the atrophy and the negative Babinski sign, here the positive Babinski sign. Here you are going to see the spasticity, like stiffness of the body, and flaccidity, there is no tone in the body of the lower motor neuron. Next, stretch reflex versus the inverse stretch reflex. Stretch reflex is present in the muscle spindle. Inverse stretch reflex is present in the Golgi tendon. What are the efferent signals? Group 1A and the 2A, and the efferent signals are the gamma motor neuron. And effect is going to be the contraction of the muscle and the detects the lengthening of the muscle. This is also known as a myotactic reflex. Inverse stretch reflex, the afferent fibers are the group 1B and the efferent will be the gamma motor neuron. Effect is the relaxation and detecting of the tension. Lengthening reaction is known as the inverse stretch reflex. Hypothalamic nuclei, very important. Anterior hypothalamus for the heat, posterior hypothalamus for the cold, lateral for the hunger, ventromedial for the satiety, supraoptic for the ADH, suprachiasmatic circadian rhythm, paraventricular oxytocin, ventrolateral is going to be the sleep, and mammillary bodies are the memory. Next, coming to the sleep cycle. So in the sleep cycle, I have made the mnemonic, guys, do the ABG. What is mean by the do the ABG? So this is going to help you with the hertz. Okay, so do the ABG. D for delta, 0 to 3 hertz, very slow. This is present in the deep sleep. And theta waves 4 to 7 hertz memory. Alpha waves is 8 to 12 hertz is in the relaxed state. Beta is 13 to 30 hertz is for the attention, and gamma waves is more than 60 for the high attention. Okay, sleep cycle is divided into the two types, NREM stage and the REM stage. NREM is going to be the 75%, REM is going to be the 25%. And NREM is divided into the three types, N1, N2, N3. In the N1, we are going to have the theta waves, which is a relaxed state, and N2 is going to be the K complexes, bruxism. Bruxism is nothing but the teeth grinding, and sleep spindles you are going to see on the EEG. N3 is the delta waves, which is present for the sleepwalking, also seen in these patients. And night terrors is common in the NREM stage, non-rapid eye movement stage. And REM, The name itself telling rapid eye movement, 25% eye movements will be seen. Muscle atonia, you are not going to feel any tone in the body. And paradoxical sleep, beta waves will be seen. PGO spikes, and neonates have the 50% of the REM sleep, and adults have the genital organ enlargement like erections will be seen, and the nightmares are associated with the REM sleep. Okay, so these are the important points that you have to learn. At least most common types, these should be learned from the nerve, neuro, and also the cellular physiology. Stay tuned for the other videos and the other subjects. Those who are new to this channel, please do subscribe and share with your friends. Until then, goodbye guys, happy preparation.